Have you ever asked yourself, what is the NFL concussion protocol? I have, and I've gone through the exact 18-page document outlining this and will distill it in a nice summary-based fashion for all of you guys today so that an average fan can better understand what's going on. For those who don't know me, my name is Sonam, and I'm a resident doctor specializing in sports and exercise medicine. On this channel, I break down injuries as they happen so that average fans can better understand what's going on. Be sure to like and subscribe if you want to stay up to date on my latest content. For now, let's get back to talking about the nuts and bolts of the NFL concussion protocol. You may be asking, what is a concussion and why do we care about it so much? So a sport-related concussion is a traumatic brain injury introduced by certain biomechanical forces. And as per the NFL protocol, there's actually four main definitions to the sport-related concussion. So first, they talk about it being either a direct blow to the head, face, neck, or somewhere else in the body, and you transmit that force to the head. The next is we talk about short-lived impairment of neurological function that resolves spontaneously. So you're thinking, you feel dazed, confused, loss of consciousness, a bit off, slurred speech, things like that. So the third thing we look at is there may be a result in neuropathological changes, but the symptoms are mostly a functional disturbance and not due to a structural injury. So this is the hallmark of differentiating a concussion from a moderate or severe traumatic brain injury. A concussion does not show up on imaging. There is no bleed, there is no structural change. There hopefully is no fracture, for example, on head imaging. And that is why it is a diagnosis of symptoms and signs. And we cannot just put someone in a CT scan and get the answer we need. And the fourth is that we talk about clinical signs and symptoms that may or may not involve loss of consciousness, so you don't need to be blacked out. You can be dazed, you can be confused, you can have a headache, you can be nauseous. You do not need to be knocked out still to be diagnosed with a concussion. The reason why it is so important is we know that players who continue to play contact-based sports while sustaining one concussion have a risk of developing something called a double hit syndrome. Essentially, you have a concussion, you haven't healed from it, and if you get hit again, the brain essentially swells, and it can actually cause sudden death after the second game. There have been multiple case reports, and because of this, organizations are getting on top of this quickly, and we need to make sure people are recovered from their concussions prior to re-entering to save from this double hit phenomenon. So in terms of the concussion protocol, the first thing the concussion protocol talks about is preseason ordeals. With the preseason, there's two main things that every athlete will get. A full physical examination, where we talk about a concussion history and do a full head-to-toe physical exam as well as a full neuro exam. The second thing that they do, which is really special for a lot of high-end sports and not so much kind of our younger sport population, is neuropsychological testing. So you do neurocognitive testing, both pencil and paper and on computer. And in addition, you will also do kind of the NFL concussion-based testing. They've adapted it from something called the SCAT-5, and we'll talk about that a little bit later in this video. But what I wanted to hone in is baseline testing is super important for a concussion, because if we know where someone starts, I can then identify if they're worse than their baseline when they're on the field and I'm doing a sideline assessment. Not everyone has great balance at baseline. So if I know what your crappy balance is when you're good, then I know your even crappier balance is worse when you have a head injury. As part of the concussion protocol, the NFL has created a beautiful poster, which is really easy to follow, with the nuts and bolts of what we need to do if we suspect someone having a concussion on game day. So the first thing I want you to know about this protocol is that it can be initiated and triggered by any one of these individuals. So teammates, coaches, athletic trainers, UMCs or UNCs essentially stand for unaffiliated neurotrauma consultants. So doctors who specialize in acute brain injuries who are there just to assess for concussion-like symptoms. And even just any medical personnel or other teammates. So basically anyone can initiate this checklist that we're looking at right here. So we'll look at the yellow box first. We're going to zoom in and look at this yellow box here. So essentially, player gets an impact to a head and they either display signs or symptoms of a concussion, or one of the medical personnel deemed that the play or the impact was dangerous enough to warrant a sideline assessment. So what are signs and symptoms of a concussion? Essentially, I'm going to put up both here, and you can take a read through it, pause the screen if you need to, but essentially, symptoms are things that patients can tell me and I cannot identify on exam. So headache, dizzy, nausea, feeling groggy. Signs are things I can pick up and identify on physical exam. So balance problems, neurological changes, the things like the fencing posture that we're going to talk about a little bit later. And those are things that we can identify by assessing our patients. Basically, if anyone is worried, the player is pulled off and taken to the blue sideline testing tent. And this is the testing tent right here. Now, before someone gets into this or while they're in there are a series of a few no-go signs. If these signs are met, the patient is pulled and taken off the field immediately. So these no-go signs include loss of consciousness, so you're blacked out, post-traumatic seizure, so you're seizing on the field, or something called the fencing posture. So this is the posture where your arms are extended out, kind of in an abnormal position as you've fallen down. And this is where the controversy over Patrick Mahomes a few weeks ago comes in. He was hit, had a head injury, had maybe displayed this fencing posture. The verdict was out between different medical professionals, and it was ultimately deemed that he did not have a concussion. And I mean, to be honest, he's playing a Super Bowl now as well. Other things include gross motor instability. So, they're very unstable, and we think it's to be a neurological cause causing it. Confusion, amnesia, not knowing where they are, not remembering who they are or how they got to the venue, for example. If any of these stop signs are there, they're out of the game for good, at least for that day. Now, say if the no-go signs are not impacted, then we go to the sideline assessment. Sideline assessment looks at a few things, and this happened in the blue tent. So we're looking at the history of the event, what happened, how concerning am I for that hit. Concussion signs and symptoms, which I've put up, and I'll stick up here as well so that you can continue to read them while we go over the rest of them. And I mean, it's by no means exhaustive, but that's what is written in the actual NFL concussion protocol. The next is we look at Maddox questions. Essentially, it's where's the venue? What field are we in? What half are we in? What stadium are we in? Who's your quarterback? Things like that, for example. Video review is really important, so we'll have someone look at the actual hit to identify how concerned we are with the hit. Certain hits look bad enough, we'll take them off and assess them in kind of the in the locker room. And the last is really a focused neurological exam. So I'll look at the neck exam, range of motion, see if there's any pain. Check for speech. Are they slurring their words? Look at how they walk. Are they veering to one side? Can they not walk straight or toe to toe? And the last is looking at eye movements and pupils. If there's something wrong with that, then we're worried about something in the actual brain that's a bit more sinister. Say if any of this is abnormal, then we pull them into the locker room for more of a detailed assessment. Now, if it's normal, or if I'm happy with all of this, for example, then we can send them back to play, all right? If we are not, we take them back to the locker room, and this is where we do the locker room exam. So that's this area right here. And the team physician plus that third-party doctor who specializes in basically brain injury will come in and do the assessment. This consists of something called the NFL SCAT, as well as a complete neurological exam. So the NFL SCAT, while I don't have the exact NFL version, it was actually drafted off of something called the Sport Concussion Assessment Tool 5th edition. And this is a scoring system that we use to identify concussions or signs and symptoms of a concussion. It's much more cumbersome than the sideline testing that we did. So this was published in the British Journal of Sports Medicine, and the NFL had said that they actually built their SCAT off of this one. So if the locker room exam is worrisome, we pull them from the game, they sit in the locker room, they sit in quiet, and they are observed by a medical professional. If they clear the locker room exam, they can get back out to playing. But you can appreciate that this can take a good 20 minutes to do, kind of through and through. Now, if someone has a concussion, how do they get back to playing? And this is the NFL's return to play protocol, and essentially it goes through 5 phases. So technically, a player can progress this entire protocol within 5 to 6 days if everything works out perfectly and come back for the next game during NFL season. Phase 1 looks at really light activity. So you're thinking on the bike for about 10 minutes, very light stretching, all medically supervised. Then if there's no symptoms with that, you go to phase 2, which is a bit more of an aerobic activity. You can get up on the bike for about 20 minutes. And this is when you'll redo things like your neurocognitive assessment and your balance testing and your SCAT testing just to make sure there's no worsening of symptoms and document resolution or improvement. The next is phase 3, where you're looking at football-specific exercises. So you're mimicking kind of football-based cardiovascular and strength training, still not on the field as much with the team, but more so you're doing a lot of dry land training. The next is phase 4. So if you're symptom-free with phase 3, then you go to phase 4, which is non-contact training drills. And essentially, if there are no symptoms and no worsening, then the next day you can go to full football clearance. If a player can engage in full contact-based practice without any symptoms, we have deemed them to be clear of a concussion, and they are okay to play the next game. So the comprehensiveness of this protocol and the fact that there's about 20 people on the field every game day whose sole purpose is to assess for a head injury just goes to show how serious the NFL is taking this. And I'm kind of glad they are, because we know that repeated concussions can cause double hit syndrome and death in our players. As well, we know as repeated head traumas can also cause things like chronic traumatic encephalopathy, which is kind of a degenerative early type of dementia. And I'll link a video up here if you're interested in more information about that. At the end of the day, we want our players to be healthy and we want to see them play great football. That's what we're here for. So we don't want to have them suffer from these catastrophic head injuries and come back too prematurely. I know it's tough for players to kind of sit on the sidelines and really take their time to get back in, but at the end of the day, we're doing it so that we can progress the time that you can play safely. Now, I hope I was able to distill a whirlwind of the concussion protocol in an easy-to-digest video. If you liked this video and found it helpful, please like and subscribe to my channel. If you have any questions or comments about this video, please leave them down below. For now, that's all.